I'm Swathi, and I'm a medical student at the Keck School of Medicine of USC. Over the past few months, I've been fortunate to be a part of the Rare Compassion program and have gotten to learn from patients who live with rare diseases. I've learned about the barriers to getting a diagnosis, issues with trust and communication with care providers, challenges of daily living, and the need for genetic testing, research, and advocacy. Despite these hurdles, people with rare diseases continue to fight on, taking it a day at a time. How do they do it? How do they cope? And what gives them hope? This is a story of 3 people coming together. Me, a medical student, Tara Vogel, an advocate and patient who's been suffering from a rare disease for almost 30 years, and Rachel, a patient with rare disease, who works at a cafe employed by people with special needs. This is a story of 2 very different diseases, GNE myopathy and TKT deficiency syndrome. And this is a story with one common thread: persisting hope and a continuing search for treatment, research, and advocacy.
Symptoms started out in my mid to late 30s first with foot drop. Now, currently, I'm unable to climb stairs, run, walk without my ankle foot orthoses, and I need help. As you could see, it's so hard for me to set up my camera, right? I can't move my arms too far. I can't move around once I set myself up. All aspects of my life is affected with this disease.
I'm very petite. My eyes get irritated and I have to figure out how to soak them.
And that's called blepharitis.
Blepharitis, yes.
And your special needs because of the syndrome, right?
Mm-hmm. I would soak my eyes with a special kind of mask for blepharitis, or in the shower I use a washcloth.
It's not a life-threatening symptom you have, but it's annoying.
Yes. I have some motor function issues. That's hard for me to cut.
So there's some special devices that are used to help with your dexterity and keep your hands away from whatever it is. So
yeah.
It's a combination of low muscle tone, fine motor issues, and motor planning issues. So a lot of activities of daily living can be difficult. So a lot of things opening a can.
There for her, even though I'm younger, but I also realized as I got older that maybe it was challenging.
You mean for Shoshana, who's actually younger than you,
yeah.
to sort of step into a role of an older sibling?
Yes.
What, to help you out when
yes.
if I wasn't home and there wasn't another caretaker in the home?
Yeah.
Yeah.
She still tries to be like a mom to me, and I just want to hear it from my mom right here.
They all have some kind of cardiac defect. Rachel's very fortunate. She has the most mild of them, called patent foramen ovale, which is a very common one anyway. So that's a very mild one, but many of the other individuals had much more significant heart defects. And then the question is there anything else medically that's coming down the line as they grow older? And having that information would be super useful, but we will not have that information unless more individuals get tested.
I was diagnosed in 2011 after 4 decades of misdiagnosis of my family. So my eldest sister started out with symptoms more than 4 decades ago. And there was a study taking place at the Children's Hospital in Boston. They were studying muscle diseases, and my family participated for almost 4 years in the study. We were in a kind of suspense, waiting for a correct diagnosis. And so in 2011, they were able to see, with what they call linkage analysis, they were able to prove that we have GNE myopathy.
My mom had to swab me to send a test in.
So most of the testing that was done on Rachel was done when she was young, as is kind of typical when there's an individual that seems to present with some kind of syndrome with intellectual disability.
I guess it's helpful to understand why I am the way I am.
I mean, we kind of knew something was there, but we never knew what it was. We didn't know if we'd get an answer, and we got an answer.
Yeah.
So now you had something that at least there were, 10 or 11 other people in the country are known to have.
Mm-hmm.
Currently, there are no treatments. This month, as we are speaking, they're supposed to start a multi-center clinical trials using a substrate called MANA. There's a lot of hope for MANA because according to the research, it shows that it's absorbed in the cells and it's like long acting. And so there's a lot of hope that, it will help us. Personally, I don't think it's a cure. And they're not, telling us it's a cure, but it will, maybe slow or stop the progression, especially in the United States with the Neuromuscular Disease Foundation. They are funding researchers and institutions to help us get to a cure. GNEM is one of the rare diseases that have so many people working on our disease. So we're very fortunate, and I'm hopeful that we'll have a cure soon.
No treatments as of yet, and such a small number of people to study. I don't think it's easy to find anyone that really wants to continue actively studying it.
I just take it day by day, do my routine.
When I first started showing symptoms, it was really, really hard. It must have taken me 5 to 8 years to come to terms with this disease. Basically, I live hour by hour and sometimes minute by minute because it could become very daunting to think about, to be totally wheelchair bound or being in a bed and have to be lifted and turned and fed. So I made a mental shift of not going there and to just look at the positive things in my life. What inspired me to keep fighting, keep living this life, seeing my eldest sister, who was at the time, didn't know what she was dealing with and had 4 young children, living in a third world country. She didn't have a wheelchair. She didn't have a rollator or walker, didn't know what she was dealing with, and had to prepare food for her family because her husband was working to take care of them. I visited her. I was living in the United States at the time, and she was living in South America. I visited her and saw her crawling on the floor, like a young child, like a baby, crawling and making the food and preparing the food for her family. And that inspires me to keep going and to help newly diagnosed or people who have been living with this disease. So with that image seared in my mind, I keep going. It inspires me to not give up.
We need more idealism and people that are, willing to go out there and fight a little bit for the individuals and their families. So interestingly, I worked pretty diligently for a year after I left my job to, with the help of my daughter Rachel's sister, to create a website and try and get the word out there about this particular syndrome. She was even presented at a major genetic conference. It really was an uphill battle, like a huge uphill battle where I felt like I was getting nowhere. I need to re-engage with that and try and see how we can get more people interested, see if I can find someone that wants to study this particular one, and see if we can find more people. But the trick is finding people to test and then getting funding for the testing. And it's a pretty big job. It's not the job of one individual. So finding networks of larger organizations that are interested in trying to help someone like me facilitate something like this would be really helpful.
There's over 7,000 rare diseases out there, and GNE myopathy and TKT deficiency are just 2 of them. But there's a world within each of those rare diseases. So of course, as a medical student on the verge of becoming a physician, it's overwhelming to learn them all. But I can try to do my research, to be an advocate for my rare disease patients, and do my best to make sure they get the timely testing, diagnosis, and appropriate treatments. It's important when we hear hoofbeats to not just think of the horses, but to also think of the zebras, so we don't misdiagnose and mistreat our patients. Genetic testing, advocacy, research are all very important components of diagnosing and treating rare diseases. But one of the most important fundamental elements is changing the way that we think so we can best serve our patients. 3 people, 2 diseases, and 1 enduring hope and passion for research, advocacy, and treatment. Rare diseases matter, and we'll continue to fight on.